Hi, welcome to Vikara, where transformation happens. I'm Dr. Julio.
I'm Patricia, medical esthetician at Vikara.
And we're so happy to talk to you today because we're talking about a lot of things. You know, at Vikara we do so many amazing things: Botox, fillers, weight loss, vitality, hormone replacement therapy, right? But people almost forget that we do just the basic stuff, right?
Esthetician.
Yeah, the facial, the maintenance, the all the stuff in between, because it's so important. And Patty, you know, I'm fortunate to have Patty here because Patty's not just an esthetician. She's a medical esthetician, but with so much experience. So tell me a little bit about your background.
My experience goes back to New York with a dermatologist, with plastic surgeons. So I really got a full knowledge, and I got to see patients at every level, from surgery to, you know, medical esthetician procedures that we do that are easy, that are non-invasive.
Yeah.
That give you that lift.
Yeah. So it's so important because, you know, experience is key, right? Because you come with so many years of experience, so much history, seeing so many complicated things, that when we do like some of our basic things, we're really looking and diagnosing more than just a spa, more than even some, you know, doctor's offices, right? Because a lot of times they're just coming in and doing something very topical. HydraFacial being one of them, right? We have a couple favorites, and I know HydraFacial is one of your favorites.
It definitely is. It's like my deep cleaning quench.
Yeah, I love that.
For the skin, and people love it because it's easy. You know, anybody can do a HydraFacial. I have men that come in consistently for HydraFacials. I have all skin types. And so you're getting a deep cleaning, but you're also getting super pampered. Yeah. So our HydraFacial goes above and beyond.
Way above and beyond. Above and beyond. HydraFacial has a protocol, right? Like step 1, 2, 3, 4. But you do so much more. Tell me a little bit about the more.
I do a lot of love. The more includes love, but more than love, relaxation, deep cleaning, a lymphatic massage, which is super important. People forget that. You know, we carry a lot of toxins in our skin, and when we release that toxin, people come out of here like, oh my God, my skin is so bright, my eyes are open, and they just love it.
Yeah, and it's an emotional release too, right? Because all that stress that we carry every day, and we all do, right? Yeah. All of that builds up, right? And just by doing that lymphatic massage, that lymphatic drainage, you're releasing not just toxins, but also emotions, right? That are building
Absolutely.
up. So it's really like life-changing, right? Tell me about a lot of people come in, they're HydraFacial, they're maintenance, right? But then you have the people with like deeper issues, right? We have a lot of complaints about like sagging skin, volume loss. As we age, right, in our 30s, we start losing a little bit of volume. By 40s, our bones actually start shrinking, right? So that same skin on the face isn't supported by the fat that we had before, the bone that we had, you know, in our 20s and early 30s. So that fat, basically, that skin basically starts to sag. And guess where it accumulates? Down here, right? Isn't that terrible? And everybody's like, well, how about this? What about this? It's terrible. So there's, you know, this is a difficult area to treat. I compare the neck skin almost similar to the skin around the eyes. It's very thin, very delicate, and we don't have all the same options that we do on the face. So one of the great options that we do have is radiofrequency, right? But radiofrequency combined with microneedling, and we use this great device called the EndyMed. So I know this is like your go-to device, right?
It's my baby, absolutely. I love EndyMed 3D because people love it. And anyone can do it. You know, it doesn't matter skin tone. But the most important thing with EndyMed is that we're approaching the skin at the 3 layers. So we're going deep, in the middle, and surface.
Yeah.
So you're getting that glow from the outside of the surfacing that we're doing. And most microneedling will be done just at a mid-layer. We're going deep into that layer where we're really getting to that collagen, that elastin. Yeah. So then we're making that skin really tight.
Yeah. And this isn't like a quick, 1, 2, 3, you're going to look good for a week. No, we're really, by going deeper, we're giving long-term results. And this is really the difference, right? 3 deep, 3 layers of tissue that we're treating. And this device, right, is... It's there, it's got a protocol, but you really you've really mastered this, because even before we've been together, right? You even had this device in New York, so you've been using this device forever. And a couple years ago, I decided, hey, you know what? Let's get the Mac Daddy device, and we upgraded to like their latest device, the Pro Max, which offers even more energy, faster treatment, and using that microneedling, RF microneedling, you know, which I think has been like one of the best things that we brought into this office. So tell me a little bit about microneedling, because microneedling and RF microneedling, that's like night and day.
Right?
Night and day.
So the RF microneedling with EndyMed, it's going vertical. The heat is going vertical. So that makes it more comfortable for the patient. It makes it for a better result also. The downtime is so little, and the results are so nice. So people come in and they're okay with doing a microneedling and saying, okay, I can have a little downtime for 3 days or so, but it's not going to take you out of the realm of your life.
So the RF microneedling, right? Because what it does is it creates holes in the skin, right? And it creates a little micro injury. But with microneedling and RF microneedling, do you just create the holes, or do you put something in it? And what we've done really is introduce regenerative aesthetics. And this is really the next level. This is the future. This is what we know is going to change like aesthetics as we know it, because we're not just putting chemicals into the skin, we're basically using the patient's own biology. So, you know, I'm fortunate to be one of the instructors for PRF EDU, which is a course that teaches doctors all over the country and all over the world on how to use platelet-rich fibrin, right? Which we basically draw blood, spin the blood, use that PRF, platelet-rich fibrin, and basically put it back into the skin. And we use this as part of our EndyMed protocol, right, for patients that need it.
Absolutely, and what a great thing to take your own body's resources to put them back in, because it boosts your skin from the inside out, right? So we talked about HydraFacial, and that's the outside in, but we want to boost the skin from the inside out, and we use your own body's nutrients to do that. How amazing is that?
And let me tell you, the PRF, it has so many factors, right? Because when we fall and we scratch ourselves, the body's doing like a bazillion things to try to like bring in cells, bring in growth factors to help heal that wound. Well, we're taking advantage of that, right? We're taking the blood, we're concentrating all those growth factors and then putting it back in the skin. This is great for people with acne, for people with like scarring, for people with even pigmentation issues, right? So it's anti-inflammatory, it's healing, it's really amazing. And then what happens if we find a patient that maybe, I don't know, we don't want to use PRF, we have other options. And what are those? What other options?
We use peptides, and
those are great. I love peptides.
Those ingredients in the peptides can be from healing, from, you know, giving your skin a boost from the inside out. We can help me out.
My gosh, there's so many things.
I know, so many things.
Right? Like, let me tell you what because peptide is a key word. People are like, peptide, but what's a peptide? Peptide, I'm going to explain it really simple, right? Because we know amino acids, it's a big chain, and peptides is like a little section of that amino acid, right? And peptides work almost like a lock and key. Our bodies have a lot of locks, right? And the peptide, what researchers figured out is that each peptide is a key to unlock that issue, right? So we have peptides for lightening skin, we have peptides for inflammation, we have peptides for hair.
There you go. That's what I was thinking.
Yes, exactly. Took the words right out of your mouth. So yeah, peptides are really amazing, and we have so many different peptides. We use peptides, you know, for weight loss, because all the GLP-1s are actually peptides, because we know that's unlocking something to help lose weight. But we use it in skincare to help like improve the quality of the skin, and it's really it's amazing, and it's something that you know, the EndyMed I think is something that can be done on a regular basis. It's great for people that have an issue or people that are just want to like maintain their skin, right? Let's not wait till we have a problem, right? Let's not wait till we have a problem. Let's like treat the skin and get ahead of the issue, right? You know, I've been doing all kinds of things. I've been into research, and people, when they see me, they're like, oh my God, what have you done? You know, you look the same. And I'm like, you know how much work it takes to look the same? Because I'm constantly something, right? Whether it be a HydraFacial, radio frequency, a photona laser, something to help maintain, you know, the quality of the skin. Because, you know, I'm aging. We're all aging. We're out in the sun. We're in Miami. It's hot. We're getting sun. We're getting damage, I'm under stress, and like all of those things are affecting the health of my skin. So I want to get ahead of it. And this is like one of the things that I think you do, which is just amazing. It's just taking care of our patients, right?
Well, I love them, and it's so easy. We really live by what we preach here at Vikara. So all of the treatments that we do, we're doing them also.
Yeah, so we hope to bring you in as one of our patients as well. Call us, text us, subscribe below, find out more about all the amazing things we have to offer, and come visit our amazing medical esthetician, Patricia. She's here all the time. We hope to see you soon.
To Vikara.